2018, the Academy of Neonatal Nursing established a Neonatal Nursing Hall of Fame with the purpose to preserve the history of neonatal nursing and highlight the contributions of our many neonatal nursing pioneers. Inductees considered for the Hall of Fame are neonatal nurses who have demonstrated a lifelong commitment to nursing, influenced the path of this profession, and made a significant or lasting contribution to the nursing care or health outcome of newborns. The Academy of Neonatal Nursing proudly inducts Drs. Terese, Verklan, and Marlene Walden into the Neonatal Nursing Hall of Fame. Both are known for their contribution as co-editors of the invaluable resource Core Curriculum for Neonatal Intensive Care Nursing, now in its 6th edition, as well as a multitude of other outstanding successes and publications over the span of their careers. With decades of experience in the NICU setting, these extraordinary neonatal nurses have had a far-reaching impact on neonatal nursing. Their curriculum guide has been an invaluable resource for neonatal nurses since 1999. Dr. Terese Verklan is a graduate of the University of Manitoba. She earned her master's and PhD from the University of Pennsylvania, focusing on perinatal and neonatal care. Over her 35-plus-year career, she has worked as a neonatal clinical nurse specialist, consultant, educator, and researcher, making significant clinical and academic contributions. She has published over 50 research articles, served as an editor and reviewer for neonatal journals, and taught in master's and doctoral programs.
What are you the most proud of, and how did you get involved as co-editor for the Core Curriculum of Neonatal Intensive Care Nursing?
Well, I was on the board of A1, the journal, the Jogging, Board of Jogging, and we were having a meeting, and this one person kept looking at me, and I thought, am I doing something wrong? What's happening? And after the end of the meeting, it lasted a couple of days, she said, would you mind staying behind? And it's like, okay, they're going to kick me off the board or something. And so it was Faye Racina, and she said, we're looking for a new editor for Core Curriculum. Would you like to do that? And I was like, whoa, yeah, I think I would. And can I think about it for the weekend? And she said, sure. And as soon as I got home, I picked up the phone and called Marlene and said, guess what you're going to be doing? And that's how we got to be the co-editors.
Congratulations, Terese Verklan. Dr. Verklan, you have added so much to the neonatal nursing profession. You have advanced us through your core curriculum. You've raised a new generation of nurse researchers through your academic work and your own research. And you've been committed to neonatal nursing excellence for as long as I can remember. You've made such a difference, you and Dr. Walden, in your writings and in your guides for new generations of neonatal nurses to recognize the important and critical role they play in babies and parents' lives. So thank you for your contributions. And thank you for the honor of participating in this. Congratulations to you. Richly deserved. My best wishes.
It is a profound honor to celebrate the induction of my esteemed friend and colleague, Dr. Terese Verklan, into the Neonatal Nursing Hall of Fame. Our journey began decades ago as specialty nurses together in different fields at a university setting hospital in the southeastern U.S. And even then, your potential to revolutionize neonatal nursing was truly unmistakable. Your groundbreaking work has transformed care for the most vulnerable patients and strengthened healthcare globally. By leveraging scientific evidence as a universal language, you have elevated neonatal care and improved outcomes worldwide. Congratulations, Terese, on this well-deserved recognition.
Dr. Marlene Walden is a graduate of Texas Women's University and earned her MSN at Texas Health Science Center, Houston, and her PhD from the University of Texas, Austin. She is a dedicated advocate for neonatal patients, their families, and nurses. With over 35 years of experience as a neonatal nurse practitioner, she has made significant contributions through her extensive research on neonatal assessment, pain management, heartbeat music therapy, and pediatric palliative care. Dr. Walden has presented her work at a multitude of conferences.
Congratulations, Marlene, for your induction into the Hall of Fame. I'm Sunny Anand, now working at Stanford University School of Medicine. I really applaud all your contributions to the assessment and management of pain in neonates, the effects of sound, light, sleep, on the pain responses of preterm infants. But beyond pain management, your research on sleep, on music therapy, compassion fatigue, animal-assisted therapy, the moral obligations of nurses during active shooter events, and your grant writing handbook have been invaluable contributions. All this is amazing, but I particularly love your approach for mentoring the nursing staff in research and evidence-based practice, and fostering a culture of continuous learning improvement in the healthcare system. So, congratulations, Marlene, well deserved, and great to see your success.
Congratulations, Marlene, for this outstanding accomplishment. I look back fondly on our time together as nurse researchers at Texas Children's Hospital. Your dissertation on pain assessment in extremely preterm neonates was really groundbreaking. I remember your work on the effects of sound and light and sleep on pain response in preterm infants and the impact that work had on nursing care. You are commended for your research over the years, and you truly deserve to be inducted into the Neonatal Nursing Hall of Fame. Cheers for this recognition, and all the best, Marilyn.
Is there any one significant moment that you talked about making a difference and the impact on families? Can you think of a significant moment or a pivotal moment in neonatal nursing in your career you'd like to share?
You know, the thing that I'm most proud of is the impact that I've had on pain assessment and management in neonates. But I think the most pivotal point was when I got my PhD. And that was a time in which I had to choose a program of research and, you know, not knowing what I should study. And I decided I would take that, you know, those experiences in nursing that really sort of kept me up at night in terms of pain management. I think there was really a great opportunity to really advance that knowledge at the bedside.
The Academy of Neonatal Nursing is delighted to honor and commemorate Drs. Walden and Verklan's contributions to neonatal nursing by inducting them into the 2025 Neonatal Nursing Hall of Fame. Congratulations.